step to curing any sickness or pain is understanding the symptoms. This is specifically true for neuropathy, and joining us today is Dr. Joshua Logan, founder of True North Health Center, to discuss what happens when someone has neuropathy. Happy almost New Year.
Almost.
We're almost there.
Right
We're getting there soon.
Yes.
But it's something that somebody can turn their whole new life around when it comes to some of these symptoms that they might be dealing with. We talked about neuropathy before, but I want you to tell us about how the condition might actually affect someone.
Yeah, so neuropathy, it's also a term for nerve damage. And so for a lot of individuals, this may affect the feet, this might affect the hands, and usually what it starts with is symptoms of tingling, burning sensations, electric sharp shooting pains, and then as it progresses, it gets to become more numbness. But that is where we can really be concerned, because with neuropathy, it is a progressive disorder, meaning it typically gets worse and it doesn't get better on its own once it hits a certain percentage of nerve damage. And so it's so important to get it checked sooner than later.
Oh my gosh, it sounds like super scary. And then you even said these symptoms can get even worse?
Yes, unfortunately. And so for a lot of individuals, depending on what the cause is, because that's the big thing, we got to get to the root cause of it. Neuropathy, as it progresses, it leads to almost complete numbness. And that's when we see a lot of individuals come into our office where they're just trying to stay out of a wheelchair, or they're in a walker and they're trying to not get to the point where they're needing to remodel the whole home to be able to have that wheelchair accessibility. And so for a lot of individuals too, because they lose a lot of the feeling, they're just trying to be able to feel the gas pedal and the brake pedal when they're driving, which is a big concern, especially for all of us driving.
Well,
right?
It gives you a little independence too, because if you no longer can drive or you can't feel it, it's kind of like, man, I have to rely on other people.
Yeah, and if it gets to the point where it becomes really bad, that's when we're fearing amputation. And that's a big concern for so many people. We have seen so many people come in where they've already had toes amputated and they're trying to keep the rest of their feet.
So what kind of treatments then does True North do with their patients?
Yes, and so we have state-of-the-art, completely natural equipment. And so we utilize different things in office, but then also most of our program is actually done at home. In fact, Cancer Centers of America, they utilize the same exact equipment for their chemo-induced neuropathy patients. And so we're state-of-the-art when it comes to that. And the wonderful thing is it's available for people to travel with, to be able to use, even at the comfort of their own home.
Okay, so last week I actually saw a commercial for medication for neuropathy, but I hear that that might not necessarily be the way we go.
That's correct. And unfortunately, medication, it just masks the symptoms. It doesn't get to the root cause. And so for nerve damage, you have to figure out what is the cause of it to be able to help heal the tissue. And so that is what we focus on within our practice completely naturally, by being able to restore blood flow and circulation, but also helping regenerate and heal the nerves again to where the body is actually healing versus just masking the symptom. And unfortunately, with medications, it leads to whole other symptoms. And most of it, it's gabapentin, it's Lyrica, it's Symbol.
And there's death always at the end of that too.
Yes, and that's
a huge side effect.
Yes, and I want to stay alive. And I want my patients to stay alive as well. And so that's why it's so important for us to get to the root cause and figure out what's taking place.
And we've got a special to share with you guys today that you can actually go and get looked at. Why don't you talk to us about that, Doctor?
Yeah, so the special, it's a $49 special. It's incredible. It allows people to be able to come to the office to get fully assessed to see what is, number one, causing the nerve damage, but also two, is this something that we can help with? And if it's something we can help with, we lay out a full recommendations with our report of findings to walk through what are the steps to be able to stop the neuropathy from getting worse, but actually reverse it, get to the root cause to where people can start dancing again, feel the gas pedal again. For my mom, is to be able to knit again. And so for everybody, it's to be able to get to live their true north is what we call it, to live their fullest potential. And that is what we want to do, is be able to offer that for our community to be able to come in and get fully assessed.
And it's nice too, because it is a $249 value for $49. So you really just want to go out and help people.
That's exactly it. And I've seen it impact my grandpa as well as my mom, to be debilitating for them. And so to be able to help our community to be able to get their life back, it's so worth it. And so just to get people answers, because unfortunately a lot of doctors are not giving people answers. It's usually just medications, to where we want to get to the root cause.
I'm all about the more natural way, and the way that you can heal your body from the inside out without having to take medication.
Exactly.
Thank you so much, Dr. Logan.
Absolutely. Thank you for having me.
And if you or someone you know is wanting more insight on neuropathy, call the number on your screen for that $49 neuropathy special. And remember, it is for the first 25 callers. We'd also like to say a special thank you to True North Health Center for bringing us this segment.